For a lot of folks, the pandemic has caused a lot of anxiety, a lot of changes, people losing family members, losing jobs, being alone, dealing with the increased cost of living. The list of things that are impacting people just goes on.
Mental Health Association of East Tennessee released a state of mental health report saying there's a rise in the number of people who are seeking out help.
Our Erica Lunsford joining us now. You spoke with the CEO of the Mental Health Association of East Tennessee. What else did he share about this report?
Ted and Brittany, Ben Harrington, the CEO of the association in East Tennessee, says the reality is there's simply not enough licensed providers to serve Knox County, and there's a need for more clinical staffers within the school system.
I think folks need to understand that the pandemic has changed the mental health world in a big way.
Ben Harrington with the Mental Health Association of East Tennessee says anxiety and depression have surged within the last couple of years, along with something else.
The data in this report shows that Knox County actually leads the other urban counties when it comes to the rate of suicide attempts or injuries causing emergency room admission.
In order to provide the help needed in a timely manner, Harrington says there needs to be more licensed mental health professionals in Knox County.
So we know that less than 10% of our professionals in the community are actually taking new patients, and that's an indicator of how challenging things are for folks that are new to seeking help now. If they need help now, there's fewer people that are available.
The surging demand for mental health care and decrease of public and private access has created what Harrington describes as the perfect storm. Many public providers are leaving because of burnout or to run their own private sector practice.
The clinical staff turnover at those public sector providers like McNabb and Cherokee and Peninsula has about doubled, and so that makes access and continued access to ongoing care even more challenging because there are fewer professionals in that sector. And that means your ability to get a timely appointment to start care may be delayed. It also may mean that your ability to have a second appointment after the initial one is stretched out farther because there's not enough clinical staff.
Harrington says statistics show 50% of all people with mental illness had their symptoms start by the age of 14 and 75% by the age of 24. Harrington says in order to tackle this problem earlier, more clinical professionals are needed within the school system.
We have one licensed social worker or counselor at each middle and high school, and the ratio should be one professional to 250 students. So if there's 1,000 young people in the building, we need 4 mental health professionals to be there to provide mental health.
Harrington also shared the report found there isn't enough diversity of mental health professionals in Knoxville, with very few Black mental health professionals and Spanish-speaking ones. He says that Hispanic, Black, and multiracial populations have experienced the highest of symptoms since the pandemic began.
Erica, though, even though there's a high demand for more health professionals, like you mentioned in the area, did he share any resources with you?
Yes, he said you can always call 911, but a new suicide call line will be activated this year. That number will be 988. And here in Knoxville, the McNabb Children's and Family Crisis Center, they created a new walk-in center, so you will have that. It just opened up last year. We'll have that information on our WVLT News app.
Erica, thank you.
We got some